I'm Kayla. I'm your occupational therapist today. And occupational therapy is just getting you back to doing the things that are meaningful in your life that you do on a daily basis. So today we're in a prehab, which is basically it's rehab before your surgery. So it's just strengthening you, and teaching you techniques to help you get back to those daily activities. And then yeah, so today, a technique that I'm going to teach you, we're going to be working on our pain management. Because are you in pain, any current pain right now?
A little bit, not too much.
Okay, yeah, and we just want to help you fix that and get you to not feel any pain. So I'm going to teach you some breathing techniques, and I have this handout here for you.
Okay.
There's 4 that we're going to do. The first one is called 4-7-8 breathing. You're going to begin comfortably sitting, so just sit comfortably. And then you're going to place the tip of your tongue behind the front of your teeth, so just let it sit. And you're going to inhale slowly through your nostrils for 4 seconds. Hold your breath for 7, and then exhale for 8. So I'll show you, and then you can repeat it. So you're going to. Okay, can you show me how I did that?
Okay. So wait, what was it? You
inhale
for
4 through your nostrils.
Okay.
And then you hold it for 7.
Okay.
And then you breathe out through your mouth for 8.
Got it. Okay. You get it.
Okay, great. And then we're just gonna do it one time together. Okay, ready?
Mm-hmm.
Okay, great job. And then the next thing we're going to do is called the pursed lip breathing. So what you're gonna do is you're gonna begin comfortably sitting again, just how you are. And then you're going to inhale slowly through your nostrils for 2 seconds this time. And then you're going to exhale through your mouth 4 seconds while puckering your lips. Yeah, interesting. So basically, I'll show you first. So, okay, can you show me now? That's a great picture to look at too. Okay, and then we can do it once together. Ready? Okay. So the next one is kind of tricky. Okay. So it's the I can't even say it. Okay, it's the alternate nostril breathing. Okay. So you're gonna have your thumb and your ring finger. Okay. So you're gonna begin comfortably sitting again. And you're gonna close your eyes, and you're gonna cover your right nostril with your thumb and inhale. And then you're gonna close it and exhale through your right nostril. So it's like, okay, I'll show you. Ready? So you're gonna, and then the next time you're gonna inhale through your right nostril like this, and then exhale. Okay, here, if you would like to try, there's the instructions, and you just repeat. Usually we repeat it 10 times, but you can just do it the once to show me. Okay,
I think I did it.
Yeah, you did it. That was great. Okay, and we can do it once together. Okay, ready? And we can close our eyes this time if that helps. Okay, ready? Good job. Okay. And the last one is called equal breathing, which sounds super simple, but it helps. So you just begin comfortably sitting, and you inhale through your nose for 4 seconds, and then you exhale for 4 seconds. So it's just equal breathing. So you'll go. Okay. So Here's the picture and then instructions. So if you want to. Okay, we can do it together.
Okay.
Okay, that's great. Do you feel a little pain going away?
I feel relaxed.
Yeah, breathing really just helps you focus on yourself, and it also lowers your heart rate down, so it can help you calm and soothe things down. So after your surgery, you are going to have some precautions where you can't bend, lift, and twist. So just when you're in pain, remember that you have ways to calm down and relax and focus on something other than that pain. So it's great working with you today.
Thanks.
Hi Mary, how are you today?
I'm good. How are you?
I'm good. So my name's Bailey and I'm going to be your OT today. Are you familiar with occupational therapy at all?
Not really.
Okay, so it is just a therapy that we use to get you back to doing everything you do in your daily life that you may want to do or that you have to do. We kind of work with you to get back to doing those things independently. So I understand that you are dealing with a level of pain in your back and you are scheduled for surgery. So we're kind of in a prehab environment here. So this is rehab before your surgery to kind of educate you on ways to manage your pain both before and after surgery, and also give you ways that you can cope with that other than your medication schedule that you're going to have post-surgery. So today we're actually going to be working with a modality, and it's just going to be the heating pad. So this is a way that you can really kind of relax before or after surgery, and the heat really helps to soothe those muscles. So we can go ahead and I'll transfer you to this couch. Before doing that though, and any heating pad will really work, and you'll just plug it in, and whatever position is most comfortable for you, that's what, feel free to get in that position.
Okay.
So we'll just set it right here for now, and then you're just going to put it on the area of your back that you feel the most pain or tenderness, and then you can lay down, sit on it, sit up, just make sure it's on that area on your back. So you can feel free to position that however you need to.
Okay.
All right. So this really is going to help your lower back because the heat is going to really relieve that stiffness in your muscles, and really just allow you to be a little more mobile with the pain that you're experiencing. But very important, you don't want to turn the heating pad up way too high. You just want to keep it on a low setting, and you kind of want to work it in intervals. So you want to do maybe 15 minutes on, 15 minutes off, 30 minutes on, 30 minutes off. And very important to not keep it on for a prolonged amount of time. We don't want to like fall asleep on it or anything. And then of course, after you're done, just for safety and everything, you can just unplug it and store it in a place that you prefer. Okay, so then once you're done with that, we can come up and back in the chair. And then we'll just, oops, sorry. And then put this thing up. All right. So how was your experience with the heating pad?
It was good. It felt nice. I liked it.
Perfect. So after you're done doing kind of multiple intervals of it and you get on a schedule of doing it daily or just every other day even, it makes it really easy to see that increase in your mobility. And it's really simple to do while you're like watching TV or any of that. So do you think that you're going to use this in your future?
Oh, I think I will. I think it's really nice. I enjoyed it.
Okay,
So
perfect.
I think it'll help a lot.
Okay, so now that we took care of the heat situation, now we're going to do a second modality, which is just cold packs. And these are very similar in usage instructions to the heating pad. However, they are very cold. So with these, you just want to place in the same spot on that lower back, wherever you're experiencing that pain. We also have two different types of ice packs that you can get. This is a really convenient and nice one because it can double as a heating pack too. So in case you're in the market for one, this one is really convenient. This is also just your standard cold pack as well. So I can give you both of those, and you can place those on your back and kind of just see what's most comfortable to you.
Okay. And do I just hold it on my back?
Yes, or if you're like against the couch or something, you can always just lean back and hold it there. Yes. And so similar to the heating pad, you're gonna wanna keep that ice pack on there for no longer than really 15 to 20 minutes. And then the nice thing is you can alternate cold pack and heating pad, and that also will increase that mobility in your lower back and really help you deal with that pain. So they do have different functions with the heating pad, like I mentioned, that just decreases that muscle stiffness, but with the cold pack, that's going to decrease that swelling that's around those muscles that's causing kind of that pressure. So using both items really are gonna help you with mobility a lot in your occupations. Okay, so it was very nice working with you today. I have made you a little handout here that basically reiterates everything we talked about. So all of the rules on the heating pad, no longer than like 20 to 30 minutes on the heating pad, with the cold pack no longer than 15 to 20, and then also kind of your rules on how to alternate them appropriately are listed on here as well. So you can keep that, and I will see you again when I visit you next.
Hi, I'm Kelsey and I'm going to be your occupational therapist today. Is it okay if I call you Mary? Okay, today we're just going to be doing some stretching to help your lower back pain. And stretching can just help release some stiffness and just get that blood flow. And if you know you're going to be really active that day, you can do some stretching beforehand to help prevent some pain. Also, if you were just being active, doing a walk or out shopping or whatever you may be doing, you can come back home and stretch. And then you can do the ice and heat if you need to. Do you know what occupational therapy is?
Not really.
Okay, it's just going to help you work on things that you do in your daily life and help you get back to doing those things. So we can go ahead and start our stretching. So we can go ahead and do it on the floor, and I'm going to bring my phone for the timer. Now I am going to demonstrate it for you. So the first one we are going to be doing is what I call the mermaid. So you can put your hands up here and press up, and if you are feeling too much pain, you can go down on your elbows and just try to arch that back to reduce some stiffness. But at any point today, if you are feeling too much pain, you don't have to do them and you can stop. But we are going to try to hold the stretch for 30 seconds. So we can go ahead and get in position, and then once you're ready, I'll start. And then just helping you breathe during this will make it easier. I'm just using those breathing techniques. And then just remember you can go down to your elbows if that's more comfortable. Okay. Now this next one, and then you can sit back down. To get back in your comfortable position, we are just going to stay on our knees and sit back, and we're going to reach forward and just try to release some of that pressure on our back here. And then if you feel uncomfortable again, we can just sit back up. All right, so let me start our timer. All right, we can go into our stretching position. Do you like to go on a lot of walks?
Yeah, I go on them sometimes after dinner, stuff
Okay.
like that.
Well, this will really help you try to not feel pain while you're exercising and just doing it beforehand. All right, just a few more seconds. Do you feel this helping relieve any pain? Okay. All right, that 30 seconds is up. Oh, let me stop my timer. All right, now we're gonna lay on our back. And this one you can do in bed as well if you do start feeling some pain at night. So you can just cross your right leg over and reach this arm out and kind of try to twist here at the waist, and it helps relieve some of the pain here. And then again, if you do need to stop, we can do so. All right, are you ready? All right, you can get into position and just push the arm out. Good job. And pull that leg over. I feel like the further you pull this leg over, the more it stretches. And then you can lift this with your arm. Tilt this more. All right, just a few more seconds. Does the stretch feel okay?
It feels good.
Okay. All right, so we can switch to the next side. All right, get the timer set up. All right, and we can get into position. Cross that left leg over, and then put out that left arm. Do you notice any more pain on a certain side, or is it about the same?
It's about the same. I think it's equal between the two.
Okay. Just a few more seconds. Alright. Now we can set up. Now we do have a few more stretches, and I feel like we can go ahead and stand up. These stretches on days you are feeling more pain, I feel like these stretches will be easier because those might be a little too hard for you. So we're just going to take our arm over our head and try to reach. And then I'll go ahead and start the timer. And we'll do that for 30 seconds. Are you experiencing any pain, or do you think it's helping?
I think it's helping.
Okay. We have a few more seconds. Have you done any of these stretches before?
I've done the mermaid one in my yoga class before, I think.
Okay, so you're familiar to these. All right, so we're done with that one. And then we're just gonna do the other side. Let me get our timer set. We're gonna reach over our head and to the other side. I think we've got about 15 seconds left. And then 10 seconds. Okay, good job. All right, so we can come back and, oh, let me stop my timer. All right, we can come back and sit down. You did a good job of stretching today, and using those stretches just like in the morning before you're active will help you not have pain throughout the day and help relieve that stiffness. But I enjoyed talking to you today, and I'll see you next session.
Yes, thank you.